are looking at today core technologies in digital dentistry. Okay, and again, there is no point in talking about this again, that how we have been in the stone age when it comes to practice, manual practicing in dentistry. But I've emphasized it, and I can't say this enough, that digital dentistry has is thriving on a powerful ecosystem of interactive technology. So it's not one technology. What we mean by interactive, interconnected technologies is that this one links to that one and this one links to the other one. So you bring a group of different technologies together in order to have that efficient workflow in a digital laboratory or a digital dental practice. So these digital tools are performing, they are transforming rather how dental professionals diagnose and treat conditions, and the way also that we engage with our patients and manage our practices. So that is an aspect of practice management there. How do we actually manage the day-to-day activities that happen in our practices? So these digital dentistries have transformed that. Our engagement with our patients, we are going to look at teledentistry as well. Our engagement with the patient has changed, and that is more efficient now. It has been transformed significantly. Treatment conditions, how we treat dental conditions, have also improved. Diagnosis has also improved. So let us look in depth into each of these technologies that we have talked about so far in general. So the first one that we will be looking at is the iOS. Okay, that is what we call iOS. That is Intra Oral Scanners. All right. So intraoral scanners are very, very effective in giving us real-time image of the patient mouth. Okay, this will give us real-time image of the patient mouth. This is no longer the case where to get an image of a patient's mouth, you need to take an impression, go out, wax it, produce a replica of that patient's oral cavity, but now, or the patient's teeth. But now, with the intraoral scanners, we can have a live image of the patient's mouth, and we can actually make more accurate diagnosis for the patient. So these intraoral scanners, they have replaced the traditional use of impression trays and alternate materials in the dental practice. Okay, so if you are still using alternate and impression materials in your practice, just know that you are probably just practicing in the past. Okay, the dental practice has moved on. We've moved past the use of alternates. We've moved past the use of impression trays and all of that. Okay, now these are handheld devices. These are portable handheld devices that you can insert into the oral cavity to produce high resolution 3D image of the patient's mouth. Okay, so this three-dimensional image of the patient mouth can also distinguish between the teeth, the soft tissues of the mouth, and can give you pictures of the occlusion and the bite. So you can see the irregularities in the patient's occlusion. You can see everything. You can see even any developing conditions in the mouth will be very visible, and you can do that on the go. Okay, so that is 3D scanners for you. So there are some key features of these intraoral scanners that we are talking about. They are high-speed scanning materials. So somebody did say, when I asked question before, someone did say that the scanning can save time as against the traditional means of doing this. And you are right, because these scanners have high-speed resolution that they can use, to scan the teeth, and a whole dental arch can be actually scanned, and you can have the image in less than 1 minute. In less than 1 minute, you can scan a patient's mouth and you have the image, and it will never take you that short a time to manually reproduce the image of a patient's mouth in the past. Okay. The other feature of this intraoral scanner is that it gives you real-time visualization of the patient's mouth, real-time. So if someone, let's say you are doing teledentistry and a consultant is not there in person, with intraoral scanners, you can actually show that person who is in a different location the realistic image of the patient's mouth. It gives you it aids you to have that image in real time. Okay, so there is color rendering to distinguish tissues and materials. So you can use intraoral scanners to distinguish between tissues and materials in the mouth. You can use they are also powder free scanning. In most modern devices, they don't need to use all of these powdered materials that we would use if we were doing the manual way of taking impression and all of that. So let's look at some of the advantages of using these intraoral scanners. These advantages include that there is enhanced accuracy and consistency. Okay, so you can have something that is very accurate, reliably accurate, and something that is very consistent in nature. Okay, it is more accurate than the previous way of doing it. It is more consistent than the previous way of doing it. It improves the patient's comfort. We cannot emphasize this enough. The patient's comfort is very, very important in what we are doing and what we are talking about. So this enhances the patient's comfort, and there is also the possibility and the avenue to do some digital filing. It makes digital filing easy. Like I said before, you would have in your workstation, you would have piles of different patients' materials that you've used to take impression and all of that to file it for each patient. But these days, you just need to have them as a digital file. And once you're able to have them as digital files, because of intraoral scanners, what you do there is that it becomes easy to share the file with your colleagues and within the system. Okay, it becomes easy. So if your colleagues need to see the file in a different room, you don't need to manually carry that patient's file to that room. They just need to open their system, the computer system, log onto the system, and they can have access to that patient's the image of the patient's oral cavity. Okay, so and it becomes very easy to replicate. It becomes easy to replicate because you have the blueprint is already there. It enables same-day dentistry. We cannot emphasize the importance of having a same-day practice enough, because you don't want your patients coming in and out of your clinic. When your clinic is busy, we want to know that it's busy. You don't want your clinic to be busy with the same patient. Okay, how busy are you today? Oh, we were very busy, but you have seen, if you saw 50 patients today, maybe 30 of those 50 patients were the same 30 people you've seen yesterday. They were the same 30 people you saw last week, because of the long duration that it takes for you to do the forth and back in terms of the scanning. However, there are some limitations to the use of intraoral scanners, the IOS. There are some limitations to that. This include that you may struggle with the subgingival margins. Okay, so there might be some struggle in terms of capturing the subgingival margins. It may require calibration and careful handling. Okay, so that is what we call in oral examination. That is what we call intraoral and that's what we call inter-examiner and intra-examiner calibration. For example, if you wanted to, look at the, let's say you are doing dental epidemiology, for instance, and you wanted to make sure that as your examiners will be examining the patients, that they will be coming up with reliable outputs, then you need to go into what we call inter-examiner and intra-examiner reliability testing, and that requires calibration. Okay, so what we are saying here is that there might be need for calibration when it comes to the handling of these digital equipment such as the Intra Oral Scanners. Okay, and then there is initial cost to these things. These things are not cheap. I must say that they are not cheap. I was at the dentistry show in Birmingham last year, and I met with this Chinese company that had intraoral scanners that I was interested in, and I think I can't remember exactly how much they told me that it will cost me. I think it was roughly about £24,000 or something like that. I can't remember exactly how much it is. So these things are not cheap. Okay, however, there is also cost to the training. Once you begin to incorporate this into your system, you need to be trained on how to use them, and your staff also need to be trained. You need to make sure that the people using it are using it accurately and all of that. However, these are just initial costs. They are like an investment. Once you invest in it, then you can actually be able to move forward with that kind of investment, but they may also require maintenance in the long run. Now, there are some products or some systems that you might want to know about when it comes to intraoral scanners. So you have the 3D trials. This is a system in intraoral scanners also. So this one uses AI powered scanning and seamless integration with lab. Okay, so it's AI powered, the 3D trials. We have the iTero elements. This is also popular for orthodontics, in orthodontic treatment, and especially Invisalign workflow. Okay, if any one of you is interested in orthodontic dentistry or orthodontic dental technology practice, or the use of Invisalign and all of that, this very system is quite popular with that. You have the Medit i700. This is budget friendly with open architecture, so this is a bit cheaper in terms of cost. You have the Planesa Emerald X. Okay, this is another product that you might want to look up. This offers ergonomic design and fast scanning speeds as well. So these are some of the high ends of intraoral scanners. Now, moving away from intraoral scanners, we can also look at the computer-aided designs and the computer-aided manufacturing systems that we have incorporated into digital dentistry. So what are these CADs and CAM technologies? They are technologies that allow dentists and dental technicians to digitally design and fabricate restorations such as crowns, bridges, veneers, and even full dentures without all the hassle that goes with traditional dental processes and procedural workflows. So these restorations can be milled in office and sent to the dental laboratory. Okay, it can be milled in the office and sent straight to the dental laboratory. So this doesn't need to be manually transferred from here to there, and then there might be errors introduced in the process and all of that. So this can be done from the comfort of a dental office, and that is sent to the lab for finishing. So the CAD phase, at the point when you are doing the computer-aided design. So this is where you design the prosthesis using the softwares that are provided, and those softwares model dental anatomy and occlusion. So you use these softwares that are particularly designed for this phase of computer-aided design. You use that software. That software can model the dental anatomy, and also the patient's occlusion can also be modeled using at this phase. Then the manufacturing phase, which is the CAM phase, this is where you are using the milling machines. Okay, so you use the milling machines or the 3D printers to fabricate the designed restorations. So after you have designed the restoration, then you can use the milling machines to fabricate those restorations. So you are no longer, if you're a dental technologist, you are no longer needing to manually fabricate the restoration in the office and do all the dirty work by hand. These machines can actually do that work and give you a 3D printed output. Okay, so if we move forward from there to consider some of the advantages of having these systems in your dental practice. So you have greater precision and reproducibility in the work that you are doing. Okay, you can do your work with greater precision. You also have reduced human error in fabrication. You know, when you're doing, for those of you who are dental technologists, you know that there are times when you will be fabricating some dentures and an error will happen in it that might require you to redo it again, or just, I remember those days in dental school, if you visit our friends who were fabricating dentures, sometimes you will see them throwing away certain things that they have used because perhaps there was an error in the process and you just can't do this anymore. You have to chunk that away and redo it again and over and again until you, when it comes to a point though when you begin to master the craft of fabricating those dentures with minimal error. But still there may still be some errors that will happen. But with these systems, I don't want to say that we eliminate those errors, possibilities of errors completely, but that is minimized to the barest minimum. And the use of these systems also enhances aesthetics with digital smile library. So here you can actually enhance someone's aesthetics because you are relying on the accuracy of what you are doing. You can actually do what we call the digital smile design, which is one other thing that we are going to talk about very shortly. Now let's consider some of the limitations that are associated with the use of these CADs and CAM systems. Okay, high equipment cost and material cost is involved. Remember, this does not manufacture these outputs by some magic. Okay, so you still need to spend money on materials and you have to use some specialized materials to do the work, and the equipment, nobody is handing it off free of charge, and these things are quite pricey. Okay, they are huge investments that you can aim to do in your dental practice. These are very huge investments, and they are important investment that you need to do, but it's just that they are capital intensive. So that is one of the limitations that you have with incorporation of these systems into your dental practices. The other thing is the learning curve for softwares and design. Now you still need to learn how to use these systems. Okay, you still need to learn how to use these systems, and then again that will cost you time to learn them. It will cost you, you might have to either bring in an expert who will come and train your team on how to do that in your office, or you need to send your team away to be trained on how to use those systems. Whichever way you think about it, there's still some cost that is associated with that. The milling machines will require frequent maintenance. There is an article that we read previously. In that article, we were talking about the regular maintenance that is required for these machines. Again, those will come with some specialized cost, because with some of these machines you still need some specialized technicians to help you to maintain it. So if you have a lot of dental practices where you have these systems in use, you might want to consider liaising with a company that will be leasing one of their technicians to frequently come and service these machineries for you, to make sure that they are continuously working and are producing the output that you expect of them to produce. Now, some of the common CAD and CAM, that's the computer-aided and design and the computer-aided manufacturing systems. Some important systems include the CERIC. Okay, this is one of the easiest and most widely adopted one, is the CERIC. There is the CERIC. There is one that is called the Dentply. The Dentply's Sirona is one example of that. That's the machine. That machine, the Dentply Sirona, is a machine. It is quite easy and widely adopted. adopted by many dental practices. Okay, so you have the Playmaker Fit, which offers fully integrated workflow. That with this one, this PlanMaker, you can have a full workflow with the same machine, just from beginning to the end, from the time when you are taking the digital impression to the production. It all has they are all integrated in the same system. You have the ExoCAD. This one is lab favorite for its open architecture and design versatility. This one is versatile. It can do quite a lot of things, and you can use that in a dental laboratories as well. You have the 3D dental systems, which is widely used in dental laboratories for prosthetics and orthodontic appliances. Okay, so this 3D dental system is used mostly in dental laboratories for manufacturing of prosthetics as well as orthodontic appliances.